Hi everyone, thank you so much for joining us. I'm really honoured to have such an amazing panel of people with me today who have really been influential in my career, both as a student and as an educator. Before we get into any more, I really want to introduce some of the people on here. We have Lane Ochi. So in your experience, how does focusing on just knowledge or just skill alone affect the outcome of the student? You've been teaching for probably longer than I've been a dentist, I think. So,
I hate to admit that I've been an educator for 40 years. And one thing I've come to the conclusion, and you've noticed as well, just simply watching other people doing something or telling you what to do really doesn't translate into clinical well-being and success. I think it's important to understand that mastering new skills without a mentor is truly difficult. Traditional dental education is about the how, right? Whereas what you're advocating here, where mentor-based teaching focuses on the why. And once we understand the why, we can better understand the benefits of what you're learning, and so you can implement them with much more confidence, much more success. There's one thing that is very clear, and for a clinician to become confident, right? It not only comes from integrating hands-on training and learning things, knowledge, but they also need good feedback. We know that performance of tasks improve throughout our life, with repetition and practice. I can remember as a dental student, and as a dental student, I hated this exercise in dental school. They made us carve teeth out of blocks of wax. We had to carve every tooth in the arch. The first tooth they gave us a week to carve, and I think I spent 20 hours carving a single central. Well,
and you had an advantage because your father was a technician, wasn't he?
Absolutely, and I worked as a technician with him. But this concept of doing something, as I said, the how within a tenth of a millimeter was really foreign to me. So it took me a long time to learn, as well as the rest of my classmates. So the amazing thing is, we only had 12 weeks in this semester, and we had to carve all the teeth. And we were all terrified because after the first tooth, we didn't know how we were going to do it. Yet, we carved all the easy teeth first, and pretty soon we were all completing the more difficult posterior teeth in the allotted lab time. So the concept of being put under pressure, as well as hands-on skill set, the repetition, the skills came. And that really opened my eyes to how we should be teaching. Doing it fast isn't necessarily better for both the patients or ourselves, because sometimes we create an unintentional stress later down the line by not taking the time. We may end up trying in something that, and this has happened to all of us, experience is the name we give our mistakes, right? Where you just go, oh geez, what was I thinking? Well, wouldn't have we been better off slowing down a little bit? And that's one of the other things that I think comes along with a little water under the bridge, where mentorship is really important. It's like fishing, okay? When I first started fishing, I had to catch all the fish in the river. Well, then I had to catch the biggest fish. Well, now I'm to the point where I just want to go fishing. And I think dentistry is a lot like that. When we're young, we just want to do something, right? We got to pay the bills, versus as we go on in our education and our journey, we want to learn how to do it right. And then we want to learn how to do it to have a lot of fun at the same time.
Yeah.
And that's where having a mentor helps.
Those people who have attended some of our hands-ons know that they're pretty intense. Many hands-on courses are very slow. So you might spend the morning cutting the top off the tooth, and then the afternoon you do the actual reduction, and you're getting taught step by step, and it teaches you very nicely the steps of the procedure. But because it's done so slowly, you can't take that skill back to your office. You actually have to learn the procedure on your patients. And so, one of the things that's been a big driver for me with education, and I think more and more the people around me, and actually someone even contacted me from France today talking about his impressions with human factors, was the fact that we use human factors in our dental education, the understanding of how humans perform under pressure, the psychological impacts of stress on our abilities.
I was pretty much first year out, and I was high flying, started getting really fast, But then suddenly I got a lot of, post-op issues that I'd never really encountered before. I know kind of follow-up in dental school is not something that we really do. So I was very confused about why all of this was happening. Definitely had like a big slump in my confidence. And when I attended your lectures, I started, realizing that there was a lot more to dentistry than just prepping a hole of some sort and shoving some composite in. So definitely from there, I started realizing the difference between good and bad dentistry. And that's definitely changed the way that I've focused on dentistry ever since. Rather than just focusing on completing the treatment, it's focusing on the small details and making sure that these details are looked after well to ensure, we are providing patients with the best treatment that we can offer them as well. In fact, I actually slowed down a lot of my treatment. Rather than, drilling, filling, I started taking photos as you recommended and seeing all the small details that I could have missed before, undercuts or C-factors, all these things that were mentioned. So I slowed down, I focused on what made good dentistry. And from there, because I slowed down, made sure I can kind of master these things a little bit more, I started getting faster and faster and doing better dentistry.
When I was doing dentistry, I thought I was doing pretty all right. I was doing pretty fast fillings and fast crowns, and I wanted to go even faster. And so I thought, oh yeah, I'll just do Link's course and be really, really good and really fast. So that's what got me into signing up for your courses. But of course, I realized going fast is not really the best thing to do in some cases. What I actually found was, I actually really slowed down, similar to what Lisa was saying. I really slowed down. It took more time to do my fillings, more time to do my crown preps. I realized, looking back at my old cases, my old fillings, my old preps, they weren't really the best. They could have been much better. And it was kind of a painful transition, unlearning all those, some of those bad habits and learning all those new habits again, learning how to put rubber down on teeth, doing preps, all those kind of things. Over time, over the next few months, my confidence got better and better in terms of, when I do a preparation of a crown or when I do a filling, I know it's going to last long. I can tell a patient, okay, you're not going to get post-op sensitivity, it's not going to break or chip or whatever. So I found that over time, I've become more confident in my dentistry. I would say since the course finished, I would say probably 6 months after that, I've been more confident in approaching larger cases.
Planned 32 cases in 2 days, which is more than I've planned in 4 years that I've been working at that time. So that was something that I tried so many times in there, practicing, failing, that I went back home and I was just, okay, let's plan the case. Give me a live patient. This is something that really gives your hand, a memory. Now, when you have to do another veneer prep, you already know how to do that. One really good example that I personally very liked, and I've never seen that being done on a course. So after we've done multiple veneer preparation, multiple crown preparation, we switched the models and we went, okay, now let's take a real patient. So they have, one dark tooth, one tooth that has to get a crown, but you don't want to ruin it. So it's going to be minimalistic crown. Other ones are going to be veneers, but this is going to be a taco shell, and they've never heard of taco shell. But now you have to think of one and do it. And here you have a proximal caries, so you have to break that contact, but you're not breaking this contact. And so it's not about, knowing one move and applying this one move to every tooth that you see, but you actually can imagine this a real patient, a real case, and now you have to be flexible with the techniques that you learn. And I saw, with students, so when I asked, so how often do you get to do something like that? And then people who've done 2 crowns in their life before the course, A few months later, I see them posting, okay, now I've done anterior 4, and this is a major progress for, doing only 2 crowns in your life before. So that's I think that it gives you not only knowledge, it gives you actually skill and confidence.
My experience was the 2-surface amalgam at dental school. You weren't allowed to, if you failed, you actually got a failing mark. So if it wasn't good, you got a failing mark. And so you would take 3 hours to do it, but you can't do that on a patient. So the first time you treat a patient, you can't do what you learned. And because of my background in aviation, I know that the first time you fly a plane, you can't fly it slowly just so that you learn, because you'll die. It'll fall out of the sky. You have to go at full speed from the very first time. And this really feeds into, several parts of the human factor-driven education that we're developing. And that is, 1, you need repetitions. So hands-on courses. It's better to do a cram prep really fast at the start of the course, even if it's a failure, and then correct it through repetitions, than to go so slowly that it's not applicable, because you're actually not building a skill, you're just building knowledge. And the other one is the necessity of failing, but then recovering from that, and then failing and recovering, rather than trying not to fail in the training process. And all of this leads into, and the last thing you've just mentioned is that when you have that confidence and the knowledge and the skill, then you can flex that knowledge to the individual patient. The vast majority of times when people fail, it's not because they're stupid, it's not because they're ignorant, it's because under pressure of treating a patient, and dentistry is stressful, under stress, our abilities actually decrease. So they decrease by up to 70%. And so we've gone to other industries and we've assembled this course. So our new courses, and particularly the restorative fellowship and the implant course, which is coming soon, and treatment planning, they are all built around the actual way that humans work, rather than how we would like to teach. So it's not built around the easiest way to teach, it's built around how people actually operate under stress.
My hand skills were some of the worst that you'd seen. You knew my personality and stuff, so I didn't take it to heart. But you also did say that they were the worst you'd seen at the beginning of the rehab course, and then by the end of it, they had improved. And the reason they had improved is because I went from, I've only ever prepped 1 or 2 crowns in a year, to prepping 28 in a 2-day period. And I remember you asking me, have you ever prepped a veneer before? And I said no, and said, good, you're about to prep 9. So it was just that sort of just throwing in the deep end that sort of kind of gave me that sort of confidence and that repetition. Now mine was on a live patient, and it was a lot more stressful than it probably should have been, being my first time. So something that I've noticed with the students, now that I'm sort of helping with the teaching aspect of it at these hands-on courses, is they're getting the same experience that I got, but without that, the ability to cause harm to another human being. So if they make an error, then it's not as disastrous. They can learn from it without a huge negative happening. So I think it was a couple of years ago now, one of the students, I can remember where they're sitting, I can't remember their name, but they were struggling quite a lot, and I just noticed that they just didn't have the confidence in themselves to do the work. They just kept making mistake after mistake after mistake, and they were just sort of drilling themselves into a hole, basically. But by the end of the 2 days, after having just repeating everything, doing the whole sort of series of prep after prep and rebuilding everything and prepping again, while their preps weren't vastly better than they were before, they gained something that they didn't have at the beginning. They gained confidence and clarity in seeing where their mistakes were. I no longer had to tell them, okay, you've made a mistake here, here, and here. They could tell me, look, this is where my mistakes are. This is what I would need to do to correct them. And they could start seeing things that they weren't seeing before, which would go a lot further than just sort of saying, okay, here's how to do a perfect crown prep. They do a perfect crown prep and then they leave, go out into the real world, and then they're not able to sort of self-correct and sort of grow as an individual and sort of gain improvement just by practicing and practicing and practicing on their own. I'm quite self-critical and sort of a bit judgy of myself in my cases. So taking photos just fit really well into that, because I'll take a cat photo and I'll look at it and say, okay, these are the things I can improve or not. And then I started posting them. And then what I look for isn't the 10, 20 people that say, oh, you did a good job, and they just sort of like it. It's the 1 or 2 people that go, actually, you made a mistake here, or you didn't see this, or you didn't see that. And I go, you're right, I didn't see that. At the beginning, I was working in a practice, not by myself, but I didn't get a lot of mentorship. So a lot of the improvements and education about improvements with rubber dams and photography, I was just learning on the fly by people commenting on my posts. And slowly I would improve, and then I would get to the limits of what I could see with the photography equipment that I had. So like the intraoral camera then gave way to just the clinic camera that I had at another clinic. And then I got to the limits of that, and then I bought my own camera, and then I could just sort of blow an image really big and then see so many mistakes everywhere that I couldn't see before, because the camera wasn't able to show me the mistakes because it just wasn't good enough. My photography wasn't good enough to show me the things. And then you could shift the light and then see what surface texture, and then you go, okay, well now I need to start working on surface texture because I can see that now, whereas I couldn't see it before because it was just a ring flash and blurring everything out. So
I think you're finding what most people who photograph their work do, which is that the camera actually teaches you to see.
That's why I keep all my old posts up, so that people can see that progression and go, well, it's possible to just photograph your stuff and then have bad stuff and then keep getting better and better and better. And there's a progression there.
I love the initial bit where you got the pre-lectures, and that kind of set you up for the mindset. So you're already thinking, like, this is what I'm going to have to do, and the kind of building blocks are put there and the foundations are built, and then you go into it, and it started in a very logical progression. It was like a posterior quadrant, you refer to it as the workhorse, which is true, because most of us as dentists, when we start out, most of the work we do is that posterior quadrant. So it's something you can implement straight away. From day one, I was implementing that straight away, but in the course, you were doing it like over and over again. It was that initial slower basis, and then it was speed it up, and then you did like a little challenge to everyone, like, right, do as quick as you can, but you picked it up and you did it over and over again, and it was very critical at first. So when yourself or one of your training faculty would come in and they'd be like, look, you missed this, and you kind of don't look at it because you're just like, that's good enough, that'll do. It was very much, no, that won't do. You'll get these problems, you'll get these issues, and slowly you look at it. I mean, there's still things, I remember even Lena telling me on the first course that about how I view the teeth. I still think about that in terms of my crown preps. I now see undercuts I never saw before, just because I'm like looking now. I'll sit there, do the old squinty one eye, and I'll see that.
With major dentistry worse.
No, but and the thing is, I found I didn't get quicker. My appointments didn't shorten down. I got quicker on aspects. Like the prep bit, grand. Like I can do that quicker than ever. But now things like polishing the prep, cementation, that attention to detail, that's taking now a bigger part of my appointment now. And as the others have alluded to, it transforms the way you do it, and you get less complications. It's that understanding. It's like, you hear that Simon Sinek thing about the whys, and like Lane spoke about as well. It's you start understanding the whys of why did things go wrong before. When you do your follow-ups, you see, like, I know what I did wrong now. I know where I've got to correct it. Well, then you go like, oh, why did it go wrong? I don't understand. You've got something to go from.
Sure.
So it really pushed me, and it was day one. I remember I walked out first day back. I had a couple of cases I was dreading, those back-to-back quadrant cases. I just went in there with a level of confidence I didn't have before. I went like, I know what I'm doing, and I booked out a massive appointment time. But actually, I was done well ahead. I had like a nice little cheeky tea break at the end of it. It was grand. It was all good. But I just thought to myself, like, wow, I can't believe, like, before the weekend, I had a sense of dread about these patients coming in. And on the day, I just thought like, I know exactly what I need to do, and I just smashed those cases out. I'm so happy. I followed them up now. I mean, I think it's been coming to a year now. I've had the year follow-ups. I'm still looking at that like, it's been a massive difference.
It's just been a major difference in approaching large cases, especially like full arch cases. I think previous to doing the course, I would have, one, not treatment plan them, two, if they had landed in my lap, had no idea where to start. And I think that's probably the biggest thing that I've learnt from doing the course is where to start on those massive cases, because I think it can be really overwhelming. And what the course does is just, it breaks it down into such step by step, and you have so much repetition when you're there that when you do have a live patient in front of you, you're so much more comfortable because you can think, this is where I need to start. Do this, and then do this, and then do this. And of course, like everyone said, you've taught that you just need to slow down. I think I was a lot faster before I did the courses in all of my work, and you really taught me to slow down, take a lot more time, pay a lot more attention to detail. And from the first point of contact that we have with the patient and their initial exam and all the records we take and the photos and the x-rays and everything, and how we show the patient what their dentition actually looks like, and then talking to them about what options are for their teeth. I think if you taught me how to give them all of these options, and then they actually want to do big treatment with you because they think that you care, they believe in you, they think that you're confident, you've done things for them that dentists probably have never done in the past, like taking all of those photos, showing them what their teeth actually look like. You're a little bit destroyed by the end of each hands-on course, because you just do so much repetition, and it is a very intense course. It's not just sitting there for an hour prepping one surface and going having a cup of tea and a piece of cake. Like you're working a lot, and you're working under a pressurized environment, which is much more realistic to what you have when you have a patient in the chair. You know, you get to work on Monday and the first patient starts to cry. You've got to try and navigate that and not let it get to you, and then in return, cut 12 crowns on their teeth and then walk them through that as well. So I thought it prepared me really, really well for going straight into the clinic and doing the work.
How do we come up with a solution for teaching now that people can't travel? From there, we developed the fellowship, and we went to live hands-on and running it virtually. And this is really difficult. So it looks, it works easily. It's like your iPhone. It works easily, but it's not so easy to build. We built the technology, we've tested it. I just want to show you a real recording of us running education over our virtual platform. So we have the technology that we built, which allows us to deliver this same type of hands-on that people have been discussing so far, but to deliver this in a virtual manner. And it's actually interesting because as we go through, so Mohammed and I were testing this out. He was in another clinic, and we're running this over our platform. So we've developed software to allow us to communicate, so I can control the camera that is over his work, zoom in, pan, and then watch him actually do the procedure live. And then while he's doing it live, if there's something that needs a little bit of demonstration, which is exactly the same as we used to do in our live courses, I can switch him back to my camera and watch. And there's a few things that are interesting. The first one is that I realized most of the time I can actually see better live. If someone's doing something, I can actually watch them live better than I could in my old setting. I can look at what the student is doing better than looking over their shoulder. Like it's so obvious, but it's kind of not obvious too. And then when they want to watch what I do, one of the things that happens a lot when you're teaching is that a group of people all crowd around and want to watch you do the demonstration. And of course, none of them can see either, because they're looking at a tiny tooth through a mouth from 2 meters away, because they're all crowded around the bench. And so now it's quite easy for us to either do a one-on-one demonstration. With our software, we can flip to one-on-one and demonstrate just to one student. But if it's something that would be helpful for the whole group, we can switch it to the whole class. So we can switch it to the class, we can switch it to 100 people or 5 people. And for us, the virtual classes are 15 people. So there's one educator for every 15 people. So and then once you take this and you start developing the technology, it changes the way you build a curriculum. So Mohammed, you were on that when we were testing out all the equipment and filming the process of using it. So, what was your experience with using this?
The technology is seamless and it's simple to use. I was actually surprised at how well it worked. You have totally changed my perspectives and approaches in dentistry.
What did you really like about this?
Having a phantom head to practice on and an extra set of teeth will make a huge difference. Other courses, they don't have this simulation of real heads. We only have the cast that we can try on, but with this whole fellowship, when you're working on the phantom head, it makes a quite huge difference in order simulating the actual real patients.
Of course, you will be in a class, so there will be people that you'll be talking with all the way through. So for you, Mohammed, what sort of things did you see as a trade-off for this?
There will be a small trade-off, but I think it's worth doing it, especially with the current situations, and I think this is the way for the future education.
We start with back teeth because it is the workhorse. That's where you learn to prep. That's where you learn to take impressions, the basics of restorative dentistry. And then we progress you through to being able to handle a full mouth rehabilitation. Now, it's not necessary that you do full mouth rehabilitations on every single one of your patients, obviously, but the skill to do that is extremely useful even in basic cases. Now, there's 44 hours of intense, interactive, hands-on that you can attend from home. Okay, so it is interactive and you have mentorship as we've been discussing, and there are class times, but you can attend it from home with the teaching kit from RipeGlobal. It's virtual. It's tricky to say this because it's virtual and it's live. Okay, what I mean by that is it's a virtual course, but you will be on a live class, as in there will be a time that you have to attend, and then all the teachers who will be teaching that class will be on. And when you're doing the exercises, we will be logging into your camera, checking how you're going, talking to you face to face, or talking to you face to face via the computer, and checking out your work and giving you feedback and doing demonstrations in the same manner that we have been talking about. There's 20 international master educators, including some of the ones who are on here, like Lane and Alina, who helped build the curriculum. And it's about 506 CPD hours that you'll get over the course of this. And this style of education, not the virtual aspect, but the philosophy of this type of education. We've had over 400 students go through it, 432. We also have a course coming up on implantology and on treatment planning, which you can register for. We have the ability for the students to upload high definition pictures, and we can give them instant feedback, as in literally draw on the high definition picture instantly and then send it back to them. One of the things that actually was interesting for me using this technology was how fast I could switch to your camera. So normally when I'm teaching live, I have to walk around a room, and for me to stand up from one student and then 3 other students ask me questions on the way, and then I have to ask the student to get out of the way, and then I have to tidy up their bench because it's usually a mess and I can't deal with it, and then I have to sit down. So there's usually 2 to 3 minutes between, you move from one to the next, and then you actually look at their work. And so what I found as a teacher was that I could see better and I could switch between people quicker. And of course, one of the things that's amazing is that the training kit that we have developed for RipeGlobal, this kit for this fellowship course, we'll be able to use for many, many courses in the future. So that we will have layered specific courses, layered anteriors. There would be veneer courses that are just standalone courses, and soft tissue surgery and bone grafting, implants and so on, all of them which will be able to use the same kit. So once you have the kit, you can attend all sorts of courses from global educators going forward. So the question has just come in. It's about the at-home kit. It says the at-home kit looks really good. Can you tell me more about it? Okay, so the kit is designed not just for this course. Essentially, think about it as a sim lab at your home. We have designed this kit so that our courses can, we've designed it so that our courses can be structured in the way that will give you the best learning outcome. So we can, for instance, have you do a small hands-on exercise before the theory starts on your own, and then we can teach you the theory, and then which allows you to fail. And then we teach you the theory, and then we can train you intensively. So now the kit, it includes a phantom head, it includes a camera, which we know that will work with our technology. You get a 4 sets of teeth in the standard kit, genuine Frisacco teeth, and then if you need it, there are add-ons. So if you don't have your own clinic, such as an ability to get access to handpieces, then you can get an additional kit which has handpieces and so on. So that's the standard kit, and this kit will have the ability to run further courses in the future. So it's not just this one and then you have your kit sitting around doing nothing. There will be lots of our other educators from around the world will design courses for our training kit because, well, they've just suddenly realized that they can't travel either. If you don't have your own practice, so there's another question is water used? Is there suction or a catch? Okay, so yes, there is water using because you can't train on a handpiece without using water unless you want to burn the plastic and have it gum the diamond on your handpiece up. So for those of you who don't have a clinic, there is a handpiece option and it comes with a water bottle. And to make life basically simple and lower cost, we will help you get a compressed air tank. So you can get compressed air tanks from anywhere. You can get them from hardware stores, you can get them from scuba diving, you can get them, they're really cheap to rent. Okay, and because the system we use uses so little air, only needs air for pressure, it doesn't need it to work anything, it will last for months. So now, why do we teach with an electric handpiece? Because there are so many benefits to prepping with electric, and I didn't want to go with turbines just because it's easy. It is much easier to design this kit around a turbine, but also turbines don't allow you to prep teeth the way that we will teach you. The water is caught in the mannequin's head, and if you don't want it to pool up too much, you can have it going into any sort of container because there's a tube. So now there's another question that says, I work full time, will I be able to fit it in? Specifically, how many days between the modules would be and how far between? So there is actually a calendar put out. Obviously, there is a few days. The number of days that you would actually need to be available in the day is quite small because a lot of the classes will be running at night time, and what we do insist that you attend half the classes live, but the rest you can watch online. So there is a bunch of classes that you will be able to watch at your convenience. Most of the classes will have short quizzes or exams just so that you can test that you actually got what you needed out of them. But like any education, if you go to a conference, you have to be at the conference, so you can't be at work. So the dates for that are already set, and you can obviously block off your schedule for next year to suit them. But the number of days that you actually have to be out of the clinic is quite small. Here's a question that says, can the cost of the modules be broken up over 2 years? Yes, it can. So there is a payment plan which allows you to pay it off or pay for the course over the 2 years. So it's monthly rather than all up front. Courses that have a similar level of education are generally between 2 and 3 times the cost. So this virtual method has allowed us to very significantly, we worked very hard to bring the costs down to the student. For this level of teaching, it is it's amazing value, really. How will hands-on training work online? So you will attend the class. There'll be a time for your particular time zone that you need to be at the class. That means logged on with all the equipment ready. All the equipment will be shipped to you as soon as you register, or very shortly thereafter, and you will be online. You'll need your computer online, you will need to have your clinical camera online, you will need to have your actual clinical camera, such as your SLR, ready, and the handpieces and so on set up, unless you're doing it in your practice. And then the class will start, and it will run pretty much like the sorts of classes that the panelists have been discussing. So we might be doing, say, crown preps on back teeth, and you might be doing crown preps for 8 hours straight. So you will be, obviously we'll have breaks, but you will be doing repetition after repetition after repetition. Then when you need something checked, or when we want to check on your progress, we can simply log into your camera, we can zoom around, we can steer the camera so that we can see what you're doing. And then if we really want to get fine detail, we'll get you to take a high definition picture, upload it to our board, and we can draw on that so that you immediately get feedback of exactly what you need to improve. And if you need further help from there, then we'll switch cameras, so you're watching ours, and we will do a demonstration for you. So you're having trouble imagining because you haven't seen it done, but I can tell you that you can see better what we're doing and what we're teaching than you could have in any class that you've been to before. Question is, I'm not a highly skillful dentist. Will this course be on my skills at the moment? So if you were like a really highly skillful dentist, then you wouldn't need to do the course. That's the nature of education. So we want to teach people who need to be taught, not people who don't need to be taught. So it's like we want to be dentists for people with tooth problems, not dentists for people with healthy teeth. I think that for me, one of the things that's the most important is the desire of the student to learn. So you get some people who are just brand new graduates, and they are just hungry to learn, and they're probably going to get more failures more quickly than some other people. But I don't think they get more failures overall. They just compress 10 years of complications into 2 years. And they learn very quickly. So, and then there's other people who turn up to our courses after 20 years. So, you know, I think that I don't mind where people come from. What I will say is that, you know, we will make sure you meet a standard. This is not a course where you turn up and then you can get the certificate at the end, even if you haven't met a standard. You'll meet a standard by the time we get to the end. And, you know, I was thinking today, when I used to learn the piano as a child, you had to practice at home. So if you didn't have a piano at home, you could never learn. And yet as dentists, we go to a course, but we don't practice at home because we don't have the kit. So now you have the kit, you kind of have the piano, you can go and do your piano practice. You can go and do your teeth practice at home between visits. Another question come in, says, will we be able to discuss clinical cases? Yes, there will be case discussions. So clinical case discussions are built into the curriculum. It is very important for you to learn to see things the way other people, so you're not just the teachers, but the student they will give you other viewpoints as well. And also the process of delivering a case presentation, you learn more from it yourself than what you're actually taught. So it's actually just the process of delivering a case that makes you learn more than what you actually get taught. There's another question here. Will you have webcam test sessions before the actual live day? Absolutely. In fact, probably not from me because I'm not the most tech person. Here's the thing. If I can work this technology, anyone can, because I am so spoon-fed. I have Julian in IT, and I have a whole bunch of other really smart people around me who turn, like today I came in, the camera was all on and all set up. So there will be people who will help you get everything set up and working prior. So, and look, I think that we've explored this topic in significant detail today. So I just want to thank you all again very much for coming on. Thank you all very much, and thank you for joining us today. I look forward to really helping people think about how we educate, not just in our company, but in other areas of dentistry as well. So thank you very much.